Good afternoon, everyone, and thank you for choosing Across the Fence. I'm Will Michael in this afternoon for Judy Simpson. Our focus today is on health and cancer, and specifically we're going to discuss men's health and cancer. This is a particularly important discussion given that men are far less likely than women to get regular checkups, and by a variety of measures, men's health outcomes are worse than women. So in our continuing partnership with the University of Vermont Cancer Center, I want to welcome this afternoon Dr. Scott Parapato. Dr. Parapato is a Cancer Center member, a urology specialist with UVM's Medical Center. Good afternoon, Dr. Parapato. Thanks for coming in.
Thank you.
Now, this topic, men's health and cancer, that could encompass a lot. It's a broad statement. We asked you to come in today to share some specific things. So share with the viewer, why are we here today to talk about men's health and cancer?
Well, certainly men's health, cancer is a large part of that. And unfortunately, one in every two of us guys are going to have to deal with it in our lifetime. Yet most cancers are curable. So the point is, so men get educated so they can make sure they don't have a problem when things arise.
You brought along a slide that you shared with me before the program that gives a snapshot into some statistics. It's not the be-all and end-all, but our director, Lee Harnois, can put that on the screen. And give us a sense of what some of the information in here is.
Right. A couple of points that continue, unfortunately, is men will live less long than women. Some of that is cancer, some of that is other health issues, heart, obesity, and such. And some men are judged, more men are judged to be in poor health, just for how we take care of ourselves. And there's simple things we could do to get over that.
Dr. Parapato, is it fair, and I know in prepping for the program I found a lot of literature and stuff online, resources that talked about men are more likely to check what's under the engine of the hood of their car rather than check what's in their bodies. Is that fair? Do we pay enough attention as men to what's going on with our bodies?
Right. Probably in general, no, but we're getting better. One of the topics we were going to discuss today is testicular cancer, and this is kind of international testicular cancer. That involves younger men, and younger men are getting more, attuned to their bodies and taking care of themselves a little bit better than we do.
Well, as you mentioned, the one cancer particular to men is testicular cancer. You're here in April, which we note is actually Testicular Cancer Awareness Month. So this is a rare disease, but an important piece to talk about. What exactly is testicular cancer, and what is so unique about it?
Right. Well, testicular cancer is several things. One is it may involve 2,000 men in the United States, but it's one of the most common solid tumors of young, healthy men. So men in their 20s, 30s. It's also, at all stages, the most curable. And it was the huge success story for some of the early chemotherapy treatments. So the goal is that if a young man is going to develop this cancer, it's easy to find on self-examination. And the earlier you find it, the less you have to do to cure it. So it will occur, and if men are aware, they have a lot less to go through.
Let's try to raise some of that awareness today. So first of all, are some men more at risk at others?
Right, and the same as a lot of cancers. If you have a family history, if my brother, my uncle, my dad had testicular cancer, it's kind of a warning. Certain cancers do follow ethnic, so if you're Caucasian or white, you're at more risk. And one of the funny little risk factors is if you're Danish, because the Danes with a more controlled genetic pool have one of the highest incidences, probably from passing it from generation to generation. So if you have those kind of risk factors, or one of the funny ones, if 1 in 10 boys are born with a testicle that descends late, means it comes down out of the body into the scrotum late. If that's you, you're at a little more risk, ironically. But the nice thing of testis cancer is a simple self-exam, and you cannot miss a problem.
And I think it's particularly important just to pause for a moment, because we're in Vermont, because we are largely a white population. Again, one of the research notes, white men are 4 times more likely than African-American men to have testicular cancer?
Right, and again, how genetics works. It's probably from the northern climes and the Caucasian population. And you made a good point about Vermont and our ethnic background. We see 30 new testicular cancer patients right here in Burlington a year. And that's more than I saw at a regional cancer center elsewhere just because of that.
Now, one of the things that I gather that testicular cancer is not, is it is not related to injury. It is. Is that fair, or am I mischaracterizing that?
Right. Often a young man may hit themselves or have a sports, and then it brings their attention to the area.
Well, you think of baseball in particular.
Right. But ironically, no. It's one of those few cancers that's genetic, hereditary to the person, and getting hit or doesn't cause it.
But as a medical professional, you're not advocating, again, using baseball as an example. Young boys and men playing baseball should wear Cubs athletic supporters, correct?
Well, that's true. We can't tell how many testicles we fix a year due to softball, baseball, lacrosse.
Yeah. So we've talked about some of the risk. What about detection or screening? And I think you probably gave the best answer so far, which is this has a lot to do with me or you taking care of ourselves.
Right. The same way a skin cancer, if that mole changes, it's suspect. Young men, if a testis lump, which is very apparent within a testicle, shows up, it's just to bring it to someone's attention. It's that straightforward.
Okay. And once that happens, how do you treat it? And we've already said the prognosis is excellent. But how do you treat testicular cancer?
Yeah, the hope is if you find it as an early process, and then there is a surgery to remove the tumor, and 70 to 80% of men, again, if they find it early, they're done. Right at that point. 20 to 30% will be the Lance Armstrong situation where they could have cancer elsewhere in their body. But again, the miracle of testis cancer is there's very refined therapies, chemotherapy, radiation, which give very high, almost 98% cure rates across the board with limited long-term side effects, not so much.
We talked about risk factors already. One that a take-home message today, again, white men are more at risk. There are some other pieces here that you shared with me. Maybe touch on some of the other risk factors.
Right. If you do have a history of being premature little boy and having an undescended testicle, which sounds funny, but they come down during the first year of life. If you happen to be of Scandinavian, specifically Danish background, and certainly the family history, which we learn more of. If you do have someone in your family who's had a testicular cancer, just be aware.
Those are all the points on the list. There was something else, probably won't even pronounce it correctly, Klinefelter syndrome?
Yeah, very rare syndrome that young men, if they have that, they're told to watch out for testis situations.
Yeah. And let's take a minute again. Our director Lee Harnois had a sort of a bullet list that he can put back on because it's a piece that you've put together that tells us what men should watch for, check for, feel for.
Right. And it is mainly the number one thing is a lump that shouldn't be there. And these aren't small lumps. These are lumps that'll be about the big as a fingertip. So you'll know it's there or not. And the funny thing about it is it doesn't hurt, and it didn't cause from being hit. So it's like finding something that just shouldn't be there.
And it's not inappropriate. Go talk to your father. Go talk to your grandfather. Find out more about that family history if you don't already know about it.
Absolutely.
Yep. Treatment options. I've got a list here that surgery, radiation, maybe take us through that. What are the treatment options?
Sure. Again, depends on the age of the man, but it's a surgery. You have to remove part or all of a testicle. The good news is it usually, 99% of the time, will only involve one testicle, and one testicle will support a man fertility-wise and hormone-wise for their whole life. And then the hope is to find it before it spreads. But if it does spread to lymph nodes or other organs, that's where it depends on where the cancer goes, whether chemotherapy, which is medicine by vein as an outpatient, or some localized radiation treatment like you see with all the hockey players with Hodgkin's disease, it seems, will cure those other spots.
You busted one myth today because I personally would have guessed coming in that injury might play a role. So we busted one myth there. Are there myths to be broken about connections between testicular and prostate cancer? Is there any connection?
That's a good question, because we get asked that every day. Fortunately, there is not. And matter of fact, with testicle cancer, and you're dealing with 20, 30-year-old, sometimes young man, there's not actually an associated with other cancers. It's just a bad luck situation. But it's a situation, if you find it early again, it's not a lot of fuss to turn it around.
And as we've said several times, I do want to reinforce an enormously survivable disease.
Yes.
But the key is being aware, in tune, asking questions. So as a survivable disease, then, we now have folks living, they've survived through this. Men have, are there specific issues that they then face beyond 35 into their 50s or 60s?
Yeah,
Does it put them at risk? Or again, the basic idea is what issues do survivors face?
Yeah, the survivors, again, will live a perfectly normal life in an all-male context. What's interesting, and this is where early detection is important, if I'm going to have a testicular cancer and I find it early and I just need a limited surgery and I don't need chemotherapy and I don't need radiation therapy, then there's no risk. 20, 30 years. If I have chemotherapy or radiation, then unfortunately there's a little bit of a risk of other cancers and some other side effects. But so that's why early detection takes that away if you could find it early.
Yep. Early detection, nutrition, there's going to be a host of things coming up this June.
Yeah.
The UVM Cancer Center hosting its first ever men's health and cancer event. This is a conference. To give our viewers a sense what's happening. Again, why would this be important, Scott?
Yeah, we're very excited, and this is another thing we've learned from the women. Burlington and the Vermont Cancer Center and University of Vermont has run one of the world's best women's health. Used to start as a breast cancer conference. And it's fascinating because it involves scientists, patients, families, and everyone together has overlapping conferences, information, and it's very exciting. So now for the first time, we're starting with a men's program. So we're really looking forward to that getting going.
I do note in some of the pieces that you mentioned, I know on the women's side, nutrition in the last few years has been added. And that's again, probably another place that men, frankly, lag behind, whether we don't have the culinary skills, whether we're on the run. Take a moment, about a couple of minutes left here, and I don't know if you wanted to deliver any kind of nutritional message that sometimes goes over our head, but again, even if we're reaching one or two guys today with some of this information.
Right, well, it's certainly super important for cancer prevention because our immune system is fighting cancer all the time, even before we have cancer. And by having that immune system, which is balanced meals, different ways to get around different intolerances, and magically the incidence of cancer goes down. And God forbid we're fighting cancer, to have a good nutrition, those men can just do better. And these kind of conferences are exciting because it brings all those people with information that we want to learn together.
Everyone is right there in the same spot.
Yeah.
Again, about a minute left. Who should consider attending? Who would you like to see there? Who would you like to run into and have a conversation with?
Yeah. Except for the speakers in all the different areas, I'd like to see all interested men and, most importantly, their families. And it's been gratifying. A lot of men we take care of, their families get proactive and they come to the support groups and that. And we're hoping at this kind of conference that everyone comes together.
And we're going to point out the Men's Health and Cancer Conference is free. It is taking place Friday, June 26th at the University of Vermont. You can get more information and you can register by going to the website that's on your screen. That's www.vermontcancer.org, vermontcancer.org. Dr. Scott Parapato, thank you very much. It was a pleasure. I've very much enjoyed our discussion, and I know I certainly learned something.
Thank you very much.
Thanks for coming in. That is our program for today. We know you have choices, so thanks for choosing us. I'm Will Michael, inviting you to join us back here each weekday afternoon for another visit across the fence.